Everybody ready? Commander Mike Benavides, Austin Travis County EMS PIO, MikeBenavides. Thanks for joining us this afternoon. What we called you out here for is at 7 o'clock this morning, we started seeing a dramatic uptick in K2 utilization down in the central core in the downtown area. We actually were alerted to this yesterday evening. We started tracking that information yesterday evening. However, we don't have those numbers for you, and we'll put those out later on this evening at about 7 o'clock with a full 24-hour what we've seen over the last 24 hours. So since 7 a.m. this morning, we've seen, we've responded to 28 incidents. We've responded to 22 incidents involving 28 patients, and that is a short period of time. That's in the last 7 hours that we've seen this dramatic uptick in K2 utilization in the core. Our action plan is that we've already relocated 2 additional ambulances to that area in order to assist and with our current response assets that are normally downtown. And we've also began to utilize a patient rotation so that we're not inundating Brackenridge or St. David's with all these patients. So we've instituted rotation for patients so that we're spreading the patients out to South Austin, and to other locations within the city, to other medical facilities. That's what we have for you at this moment. We want to remind everybody that utilizing this, and what we've always talked about with Austin Travis County EMS, is that utilizing these products, this is like playing a game of Russian roulette. Don't know what's in these products. You don't know what you're ingesting or inhaling, and so this could be a lethal combination. We throw in the fact that we've got some high precipitation. It's keeping things a little bit hotter as far as in the environment, and with that, one of the signs and symptoms of K2 utilization is hyperthermia, which means the body core temperature increases, and then you put them out, if they're utilizing out in this air, in these ambient conditions where it's already hot, then obviously that too could be lethal. A lot of these users, or many of these users, may have underlying medical history. That underlying medical history, in conjunction with this utilization of synthetic cannabinoid, is what it's called, or K2, that too could be a lethal combination. One of the other things that we'd like to remind people, what we're seeing right now. What we're seeing, the vast majority of our incidents that are coming in with this, in connection with utilization, is seizures, unconsciousness, and then we still continue to see a little bit of combative behavior from the patients that are utilizing. That's what I have for you at this moment. Now, any kind of questions?
So, like you said, K2 can be anything. Do you know what specific chemical is causing this reaction in people?
No, and that's one of the things that has always been problematic in the utilization and the tracking of these products, is that you don't know what chemical compounds or what chemical substances these products are laced with, and so we are very reluctant to even talk about it because they consistently change. And one of the other things that we talk about when it comes from the consistent changing of these compounds is that the state of Texas enacted a law that went into effect last year in September. We did see a decrease in utilization in our immediate location. I can't speak for the rest of the state, but in Austin and Travis County, we did see a decrease in utilization. This is the first time since September of last year that we've seen this dramatic uptick, and it was a dramatic uptick to the point where we needed to relocate additional resources to that area in order to help assist our medics downtown.
Are you guys calling this like a bad batch? I mean, do we think that these people who are getting sick all kind of took the same batch of this particular type of K2?
We're not calling it a bad batch because there's no good batch. So every batch is a bad batch. One of those things that, and we don't utilize the terminology overdose when we're talking to these. We talk about ingestion or inhalation, and it's a toxic exposure, whether it be toxic inhalation or toxic ingestion. And the reason why we don't utilize the term overdose, I know it's a more common use of terminology, but the term overdose would seem to indicate that there would be a proper dose, and they're just overdoing it with their dosing. We're saying that one hit off of K2 or any of these synthetics could be life-threatening.
What you guys said you're bringing more ambulances down to that area. So how is that just so you guys can get to them quicker and try to get these people to the hospital and safe?
It's a combination of all those things. Number one, we've got our Austin Travis County EMS medics, the existing assets that work downtown. They were inundated with all of these calls for response in many of these cases. Many of these incidents, we didn't have just one patient. In one case, one incident that comes to mind, we had 5. So with that, you've got one ambulance, you've got Austin Police Department that has been notified. They've contacted us and they are taking their corrective measures. We've got Austin Fire Department. Their assets are being overrun or inundated in the assistance of this event. So we are trying to relocate additional assets to that area. And we're actually kind of running it like a mass casualty incident right now. That's why we've created kind of an individual who is overseeing a command staff. Our command staff are overseeing it. We're continuing to monitor it, and then they are relocating assets down there and then putting in that patient rotation.
Well, we were talking a little while ago. I was talking about how we saw a lot of ambulances in other parts of downtown, not just at the Arch. Is that what you were just talking about with the mass casualty?
Yes, that we are in essence staging additional resources down into that area where we're seeing the highest call volume for this event.
So are you responding before the calls come in? Like, do you have paramedics down there that are looking for signs of this?
No, we're waiting for the calls to come in, but we don't want to wait for our resources, our ambulances that may be further away to have to get there, and then having police and fire department having to wait on the medics in order to get there. So that's why we are pre-staging two additional ambulances to that area in an effort to help combat this.
Is there any particular area besides the Arch where you're seeing a lot of calls coming in?
It's just in the downtown corridor. It's not isolated to the Arch or to Salvation Army or to Caritas. It is in the downtown corridor. We're seeing them as far as Congress, down to Cesar Chavez, on the other side of the interstate, and then of course the vast majority are in the downtown corridor.
But some are at the Arch?
Some are in and around. I don't have that exact information. I don't have that information. No, historically we've seen users of all ages, all socioeconomic groups. So we've seen it historically in every population set.
How would you describe, when you have these kind of events where there's so many patients that you're dealing with at one time, how would you describe it? Is it chaotic? What's it like for an EMS, a medic out there dealing with this?
Being an EMS, almost everything is always kind of chaotic. However, what we do is we bring calm and semblance to that chaos, and our medics are very professional and very good at what they do. And so we've got some of the best medics in the country working out there right now, and they are managing it probably better than I can even put words to. So they're doing a great job, given all the chaos, as you put it, all the chaos that's going on down there right now.
Having dealt with this situation for the past 2 years, like you talked about, seeing this dramatic uptick in such a short period, where are your thoughts right now as far as just trying to get a handle on this?
Well, again, this isn't our first time dealing with this. In fact, I've got some numbers. In 2015, we actually ran 2,256 incidents of synthetic cannabinoid or K2 or spice. There's a lot of different street language for it. We ran 2,256 incidents, and then just from January 1 of this year through June, we've already run 526, and we're not counting. Obviously, that doesn't take into account the events of today.
You mentioned the symptoms that what this is causing. Can you talk to us about those long-term effects of having episodes?
Obviously, the most dramatic and the most lethal is, the fatality. Someone utilizing it just once and then being deceased as a result of this. But we have heard, it's difficult for us to speak in depth about the long-term effects because once we drop patients off or once we transport them to the hospitals, then that's kind of where our role stops with them. However, in speaking and in hearing with some of our medical facilities, some of them have voiced that some of these patients have actually ended up in nursing homes as a result. So I mean, all it takes is one dose, and that's the message that we're trying to convey, is that there is no safe dose. There's no safe utilization of these products. One dose can be lethal.
Talk about how taxing this is on your resources to have these ambulances stay downtown. I mean, is that causing you to not be able to respond to other calls, anything like that?
Absolutely not. We are well proportioned in our we have assets all over the place. We've got individuals that we can bring in, and so this while it does create a tax on that area, it doesn't necessarily create an entire tax on the entire system, because we've got other assets that we can pull in and bring in that are closer, that are of lower call volume in order to assist. And the trucks that we have relocated to the downtown area, those are our demand trucks. And so that is the ideal use of a demand truck, because they are on duty just for peak load hours. And if they're on, so they can be anywhere. They're not situated to necessarily to one location within the city or the county. So those demand elements, they can go and we can situate them. So we're actually already prepared for this and for any other type of event that may occur in Austin and Travis County whenever it occurs.
How are you spreading this message of don't smoke or sip and will take some time to the people who aren't necessarily watching TV and they're not on our phone? You know, they are at the arts, they're at the Salvation. How are you guys communicating?
Part of this is a cooperative effort. You know, we have Austin Police Department that does that, and then we have our community health paramedics that are embedded with a lot of this patient population on a daily basis, and they can continue to spread that, and they do continue to spread the effects, the ill effects, and to not utilize these things. And so we've got our community, the Austin Travis County EMS Community Health Paramedic Program, and so they do a lot in their daily activities in order to help combat this and create awareness to it.
Are any of the patients critical from today or yesterday?
I don't have that information, but we can certainly look into that for you. It's difficult to determine because many of these people, without having that information of what process or whether they've been discharged from the medical facilities, from the hospitals, it's difficult for us to track what happens beyond the emergency room doors for us.
But you are able to say whether you transfer.
Correct, and I would say that some of these patients have been transported with that designation. I don't have the number of how many patients have.
Can you talk a little bit about, you know, when you're dealing with this synthetic drug, it seems like there's a new strain every so often. How does it make your jobs difficult? I mean, because it's not just combating one single strain, if you will, of this drug. I mean, doesn't that make it a bigger issue?
Well, it becomes a guessing game. And so, but we're not necessarily treating the effects of K2, we're treating patients. So we treat their signs and symptoms. So if they are seizing, then we treat the seizure. If they're unconscious, then we take our necessary steps in our protocols in order to deal with the unconsciousness. If they are acting combative, then we use the necessary steps and necessary protocols in order to combat that. So it is treating the patients and trying to get into a guessing game of what may work and what doesn't, or what they may have ingested or what they haven't. We deal with the signs and symptoms.
And just so that I understand why 7th and West River's been shut down, is that basically to kind of set up an area where EMS can be on scene and respond as quickly as possible?
For us, yes. I can't speak for police, as they're the ones who enacted that measure, and they may be doing that's maybe part of their investigation in order to kind of narrow it down. But that's something for Austin Police Department to speak at. But for us, it at least helped us because we were able to isolate the area and start just committing resources to that specific area.
Just to clarify, K2 is a brand. You guys are focusing on synthetic marijuana or drugs?
Yeah, it's synthetic marijuana is a common name. I think the chemical name is synthetic cannabinoid, and so those are that's the terminology that's used, I think, scientifically. But synthetic marijuana is a more common name, and then K2 Spice. These are just Scooby snacks, and there's several other different street names for it, depending on who's pushing out the product and how it's packaged. That I don't know.
Actually, when I was just there, it was tweeted that it shut down, but it was not shut down when we were there 10 minutes ago.
Okay.
So I think that maybe that was like a false.
And again, that would be for law enforcement to speak to, since we don't shut down the roads.
Anything else you'd like to add?
Just thank you for being out here, getting this message out, letting the community know, creating this awareness, and let's see if we can't help reduce this, because this is a poison on our streets. Thank you. Are we doing two?